Here we have MRI on 70-year-old with history of cognitive decline. Unfortunately, the patient could not have gradient echo or SWI sequence, but despite that, we have got a small incidental finding which is of little or no clinical significance, but an interesting way to find this abnormality. I have shown all the images in the right plane. I will just magnify each one of the sequences and show the left lentiform nucleus. On the axial PD and axial T2, the left lentiform nucleus appears normal. On the axial flare and coronal T2, the left lentiform nucleus appears normal, but on diffusion weighted images, we see this rounded low signal intensity on p-value of 0 and 500, and also on p-value of 1000, and it shows low signal intensity on ADC mapping. We do not have gradient echo, but despite that, we can fairly confidently make a diagnosis of a small cavernoma in the posterior aspect of the left lentiform nucleus because it shows a small round low signal intensity on DWI on all values as well as in the ADC mapping. Subsequently, we recalled the patient for Haem sequence or gradient echo sequence, which shows blooming effect and confirms the diagnosis of cavernoma. So in summary, here I wanted to show how to diagnose a cavernoma on DWI images when we do not have gradient echo sequences.